8 cancer signs you're probably ignoring. Don't miss this. Could your body be sending you warning signals about cancer that you're missing? What are the subtle signs that might suggest cancer is developing, and why are they so easy to overlook? Cancer affects millions worldwide, yet its early signs are often misunderstood or ignored. Knowing these signs isn't just about detection, it's about timely intervention, which can dramatically influence outcomes. But what are these signs, and how can they vary from person to person? In an age where information is at our fingertips, yet often filtered through commercial interests, understanding the true early markers of cancer can be obscured. We're here to cut through the noise, bringing you clear, verified signs. Stay with us as we guide you through each of these signs, helping you understand your body's signals and when to seek medical advice. A quick disclaimer, this video is for educational purposes only and not a substitute for medical advice. Please consult your healthcare provider for any medical concerns. All information provided is supported by credible, peer-reviewed research. References and links to original studies are included in the description for full transparency. 1. Persistent fatigue. Persistent fatigue can be one of the earliest signs that cancer is growing in your body. If you notice that your energy levels have plummeted and no amount of sleep or rest seems to help, it's time to pay attention. This kind of fatigue isn't the usual tiredness from a busy day, it's a deep, unrelenting exhaustion. This fatigue can be particularly indicative of cancers like leukemia or lymphoma. These cancers affect the blood and bone marrow, disrupting your body's ability to produce healthy blood cells. As a result, you feel worn out no matter how much you try to recuperate. In addition to fatigue, you might also experience muscle weakness or confusion. These symptoms can be related to cancers that impact hormone levels or cause internal bleeding, such as colon or stomach cancer. When cancer disrupts your body's normal functions, it can lead to a constant state of tiredness and other related symptoms. Persistent fatigue can be a tricky symptom because it's often mistaken for stress or overwork. However, if you find yourself unusually tired for an extended period, it's crucial to consult a doctor. They can perform the necessary tests to determine if there is an underlying issue that needs to be addressed. Paying attention to your body's signals is essential. Fatigue might seem like a minor issue, but when it's persistent and unexplained, it can be a sign that something more serious is going on. 2. Persistent headache. A headache that won't go away, despite taking over-the-counter or prescribed medications, can be alarming. If you find yourself with a persistent headache lasting more than 2 weeks, it's time to see a doctor. This type of headache could be a warning sign of something more serious, such as a brain tumor or other brain cancers. In addition to the headache itself, other neurological symptoms can accompany it. These might include blurred or double vision, changes in hearing, or facial drooping. If you experience any of these symptoms along with a persistent headache, it's essential to get them checked out promptly. Seizures or other unusual neurological events should also be evaluated by a healthcare professional. These symptoms can indicate changes in the brain that need immediate attention. Brain tumors can press on nerves and disrupt normal brain function, leading to these types of symptoms. Ignoring a persistent headache and associated symptoms can be dangerous. While not all headaches are related to cancer, those that don't respond to typical treatments and last for an extended period should be investigated thoroughly. Early detection can make a significant difference in the treatment and management of brain tumors and other related conditions. Listening to your body and recognizing when something isn't right is vital. If you have a headache that persists and comes with other neurological symptoms, don't delay seeking medical help. It's always better to be cautious and ensure that you receive the appropriate care.
3. New or unexplained pain. Persistent pain that doesn't have an obvious cause, like an injury or illness, and doesn't respond to regular treatments should be evaluated by a doctor. Pain is your body's way of signaling that something is wrong. If you have pain that lingers without explanation, it could be a sign of cancer. For example, abdominal pain could indicate prostate, bladder, testicular, or penile cancer in men. In women, unusual pain or sensitivity in the breasts might be a symptom of breast cancer. This pain isn't typical and doesn't go away with usual remedies, indicating that something more serious might be happening. Pain can also be a symptom of internal cancers. For instance, a persistent feeling of heaviness or swelling in the scrotum could signal testicular cancer. Similarly, ongoing pain in the abdomen might suggest issues like liver or pancreatic cancer. These types of pain are often overlooked or attributed to less severe causes, but they warrant a closer look. Ignoring unexplained pain can be dangerous. It's easy to dismiss pain as a minor issue, but if it persists and isn't linked to a known cause, it needs to be investigated. 4. Excessive bruising. Excessive bruising in unusual places on your body can be a sign of certain blood cancers. If you notice bruises appearing without any clear cause, it's important to see a doctor. These types of bruises can indicate issues with your blood cells, such as leukemia. Leukemia affects your body's ability to produce healthy blood cells, leading to symptoms like excessive bruising. Bruises might appear on your arms, legs, or other areas where you wouldn't typically expect to see them. This symptom should not be ignored, as it can be an early sign of a serious condition. In addition to bruising, you might notice other symptoms such as frequent nosebleeds or bleeding gums. These can also be signs of blood disorders or cancers. If you experience any of these symptoms, it's crucial to get them checked out by a healthcare provider. Pay attention to changes in your body, including unexplained bruising. Cancer can present itself in many ways, and recognizing the early signs is crucial for early detection and treatment. 5. A cough or hoarseness that won't go away. A persistent cough or hoarseness that lingers for more than 2 weeks should be evaluated by a doctor. If you have a dry, hacking cough that doesn't improve, it might be a sign of lung cancer. Coughing up blood or bloody discharge is particularly concerning and needs immediate medical attention. Hoarseness or a raspy, strained voice that doesn't go away can also be a warning sign. If you notice changes in your voice, especially if accompanied by difficulty swallowing or pain in your neck or throat, these symptoms could indicate thyroid or throat cancers. Persistent coughing and hoarseness are often overlooked as minor issues. However, when these symptoms persist, they can be indicative of more severe conditions. Lung cancer in particular can cause chronic coughing that doesn't respond to typical treatments. If you have a cough or hoarseness that lasts more than 2 weeks, consult a healthcare provider to determine the underlying cause and appropriate treatment. 6. Blood in the urine or stool. Noticing blood in your urine or stool can be alarming and should never be ignored. Blood in the stool can appear black, tarry, or red, and blood in the urine can be pink, red, or dark brown. These symptoms could be indicative of serious conditions, including cancer. Blood in the stool may signal digestive system cancers such as colon or rectal cancer. It can also be a sign of inflammatory bowel disease or ulcerative colitis. These conditions disrupt the normal functioning of your digestive tract and can lead to bleeding. Similarly, blood in the urine can be a sign of prostate or bladder cancer. It can also indicate infections or other urinary tract issues. The presence of blood is a signal that something is wrong and it needs to be evaluated by a healthcare professional. These symptoms require prompt evaluation to determine the underlying cause and appropriate treatment. Your health is too important to ignore these warning signs. 7. Mouth sores that won't heal. Mouth sores that don't heal within a couple of weeks should be taken seriously. If you notice persistent sores, lesions, or white patches on your lips, tongue, gums, or elsewhere in your mouth, it's time to get them checked out. These symptoms could indicate oral cancer. Oral cancer can develop in any part of the mouth, including the lips, tongue, and throat. If you use tobacco or drink heavily, you are at a higher risk for this type of cancer. Persistent mouth sores are not something to overlook, especially if they come with other symptoms like difficulty swallowing or unexplained weight loss. White patches in the mouth, known as leukoplakia, can also be a warning sign. Leukoplakia is a precancerous condition that can develop into cancer if left untreated. These patches might appear harmless, but need to be evaluated by a healthcare provider to determine the appropriate course of action. Ignoring mouth sores can lead to severe consequences. Oral cancer can be aggressive, and early detection is key to successful treatment. 8. Changes in urinary or bowel habits. Changes in your urinary or bowel habits can be an early sign that something isn't right in your body. If you experience constipation or diarrhea that lasts for several weeks, it's time to see a doctor. These symptoms might seem minor but can indicate serious underlying conditions, including cancer. Persistent changes in bowel habits could be a symptom of inflammatory bowel disease, like Crohn's disease. However, they can also signal colon or stomach cancer. These cancers can cause disruptions in your digestive system, leading to noticeable changes in how often and how comfortably you can go to the bathroom. Similarly, changes in urination, such as pain when urinating, increased frequency, or a weak stream, could be signs of urinary tract issues. These symptoms might indicate an enlarged prostate, a urinary tract infection, or more seriously, prostate or bladder cancers. While they can be caused by less severe conditions, they might also be early warning signs of cancer. It's always better to investigate and rule out serious issues than to ignore symptoms and risk progression of a potentially treatable condition. Being proactive about your health means paying attention to your body's signals. If you experience any persistent changes in urinary or bowel habits, consult a healthcare provider.